Hello, I'm Professor Charlotte Bolton. I'm based at the NIHR Nottingham Biomedical Research Centre and I specialise in chronic respiratory disease with a focus in multimorbidity and rehabilitation. We'd like to thank the British Lung Foundation in funding the work and those that completed the survey. Osteoporotic fractures in the general population are common, debilitating and a huge impact on symptoms. In addition, there's a significant economic burden. People with COPD are at particular risk. Many have smoked, had repeated course of steroids, have a lower BMI, often of an older age group, and in addition, they're at greater risk of falls.
So national guidance bodies such as NICE recognise that people with COPD are at greater risk of osteoporotic fractures and recommend actually carrying out assessment of bone health in this cohort of patients. However, the big question is, how is this delivered and integrated into the clinical COPD care? So we provide information for clinicians into what a pathway addressing bone health in COPD might look like. So we did this by sending questionnaires to healthcare professionals to seek their knowledge and views on delivering bone health in COPD care, as well as questionnaires to patients to seek their awareness and views on the acceptability. We then held a roundtable meeting with several key stakeholders, and we used the findings of these questionnaires, as well as current published literature on osteoporosis in COPD, to discuss and reach a consensus on what a pathway might look like that is both pragmatic and applicable to the general COPD population. From the questionnaires, we found that many healthcare professionals recognize the importance of assessing fracture risk, but did not actually carry this out due to lack of resources of time and training. And similarly, more than half of the patients with COPD stated that they had a limited understanding of osteoporosis in COPD, but stated that they would be receptive to discussing treatment options if found to be at risk. From the consensus meeting, the key points that were agreed included that all new patients should be assessed within several months of diagnosis, and current patients assessed at least every 3 to 5 years as part of their annual COPD assessment. We should be using validated fracture risk scores to determine those at risk, and that management should be holistic and include conservative measures such as smoking cessation and exercise.
We flag the need for training and time for healthcare professionals to do this as part of patient management, as well as the need for information for people with COPD about bone health, osteoporosis and fracture risk.